One way that you can get a posterior open bite is because of what's called passive intrusion from aligners. Now, if you had passive intrusion, you can resolve it by cutting the trays. Some of you guys have probably heard about this. Like, oh, you have a posterior open bite, go ahead and cut the posteriors off the trays, let the patient wear those, and they'll be fine. That's okay, and that works only if the reason why the posterior open bite occurred was because of passive intrusion. And so if you do that, you can resolve it in about 2 to 4 weeks. And the way to actually avoid this from happening to begin with is by putting bite ramps on your cases. So bite ramps are those protrusions there, those blue protrusions that you see there on that image. What those are is they are actually on the aligners. It is not something that you are bonding or putting onto the tooth like an attachment. So they're basically coming off of the tray on the palatal surface. And what that does is it ensures that the posterior teeth are not occluding with each other when the trays are in during treatment, right? Because when you've got those protrusions there in the anteriors, the anterior teeth, the mandibular anteriors, are going to make contact with the bite ramps. And by doing that, we'll actually create a little bit of space on the posteriors, which takes away some of that force on the occlusal surfaces that the aligners put onto those trays, or onto the teeth rather.